Yeah, in this presentation, we are going to see about the integumentary system guidelines. So, which I had covered fine needle aspiration alone. Okay, we will go one by one so that you can easily understand. So, there will be set of guidelines as I had already told you. There will be set of guidelines for whatever you code for CPT, for ICD, for everything. We have a guidelines to follow. By using the guidelines only, we have to code. Okay, so likewise in the integumentary system there are several guidelines for each specific topic. So today we are going to see about fine needle aspiration. So what is fine needle aspiration, it guidelines and how to code, what to add with the code and what you should not add with the code. Okay, like that we are going to see the guidelines. Fine needle aspiration. So what is fine needle aspiration? So FNA uses a needle and syringe to get a tissue or fluid sample from a suspicious mass in your body, like breast lump. Healthcare providers use it to help diagnose abnormal tissue in several areas of your body, such as your breast, thyroid, and lymph nodes. So it uses a needle and syringe to get a tissue. So if you find any abnormal tissue, like if you feel any lump in your body, they will take a tissue using the needle and syringe from that suspicious mass in your body. Okay, so these providers use it to help diagnose abnormal tissue like in several areas of your body: breast, thyroid, and lymph node. So to collect the tissue, we are using this fine needle aspiration technique. Look at the diagram. This is an ultrasound probe. Using that, we can able to see the mass of the lump in the breast. So syringe and needle, so we are taking the cells and tissue and fluid from the suspicious mass tissue, and this is the lump, that is a suspicious mass, we'll call it as lump. Now we understand what is fine needle aspiration, right? It is also called a fine needle biopsy. FNE involves using a thin needle and a syringe to pull out cells, tissue, and fluids. Your healthcare provider then sends the sample to the cytology lab. There, a cytotechnologist screens the cells and specialist called a pathologist examine them for analysis. Both providers use the study of cytology to examine the cells. So, through the fluid, the cell, the tissue we collected, they will examine the cells present in it, right? So through that we will get the result whether any like tumor cells present or not. So like that we will get the result. FNA is the least invasive, that is least damaging to your body type of biopsy, but it has limits. For certain conditions only we can use FNA. So this is the least invasive type of biopsy. So what's the difference between core biopsy and fine needle aspirations? Important questions. You need to understand, okay, anyhow it's biopsy, it's there like they are taking the tissue sample from that, not like that. You should make sure you know the difference of each key terms. What is core biopsy and what is fine needle aspiration? So core biopsy and fine needle aspiration are both types of needle biopsies. Anyhow, we are going to use needles in these two. The needle for a core needle biopsy is wider than it is used for FNA. So, the needle used for FNA is thin and the needle used for core biopsy is thick. A core biopsy gathers more tissue that can provide more information about the suspicious area than FNA can. As it has only thin needle, it will collect only small samples and tissue. But in the core needle biopsy, the needle is thick, so it will gather and collect more tissue so that we can test like more, right? So we will get more results, so we will get more information. While FNA just involves a thin needle, a core biopsy sometimes requires a small incision to insert a spring loaded biopsy needle. Okay, so FNA just involves a thin needle, so no other any incision requirement. There is no requirement for any incision for FNA. A core biopsy sometimes need an incision as the needle is very thick. So to insert a spring-loaded biopsy needle, sometimes an incision may require. Providers most commonly use core biopsies for breast biopsies so that it can collect more tissue so that we can examine more and get the accurate results and lot of information. They use FNAs for several areas of your body. Okay, now you understand what is core biopsy and fine needle aspiration. So what is fine needle aspiration used for? Exactly where we gonna use this FNA, right? So fine needle aspirations have two main purposes. One is diagnostic and is therapeutic. Healthcare providers may also use FNAs to help guide treatment in cases where cancer has spread from the original tumor site, that is metastatic cancer cell. It is going to spread from one point, it is going to spread metastatic. So pathologists can look for genetic or molecular markers in the cell samples that show if the cancer will respond better to certain cancer treatments. So in this case we are using this final aspiration. So the providers are using this FNA to help guide treatment whether like cancer cells are responding better to the treatment, whether it is spreading or not. Like that we can use FNA for this to identify these things, so whether they are responding well to the treatment, is it spreading or what. So everything we can able to know using this fine needle aspiration. Okay, so what is the exact diagnostic purpose of this fine needle aspiration? So healthcare providers can use FNA in any situation where a tissue or fluid sample would help with diagnosis. A pathologist look at the collected cells under a microscope to determine their type and characteristics. Obviously, we will use the final aspiration. We will get some sample. So the pathologist is going to view through the microscope and give you the result. So for that, so to identify what it is, so to identify the diagnosis, we are using this FNA. This is the diagnostic purpose of FNA. FNAs are one of the several type of biopsies. Obviously, it is taking tissue from your body. It is also known as biopsy. Your provider may choose FNA or a different kind of biopsy like excisional biopsy, incisional biopsy, depending on your unique situation. So what kind of, if you're having breast lump, they will use core needle biopsy. Sometimes they need to tell like you're feeling some abnormal like moss lump in your abdomen. If you want, they want to get a sample from your abdomen, they will use FNA. So according to your situation, the biopsy method may vary. So fine needle biopsies may be necessary to access a suspicious lump or mass in your body. They can help diagnose cancer, bacterial infections like bursitis or septic arthritis, non-cancerous masses like cysts, fibroadenomas or lipomas. So we can diagnose these these diseases or these like problems associated in the body through this fine needle aspiration. Providers can use FNA on almost any region of your body, but providers most commonly use it to biopsy newly identified masses in your breast, like breast cyst, thyroid, like thyroid nodules, lymph nodes, skin, with the help of imaging guidance. Okay, with the help of imaging guidance like endoscopic ultrasound and computer tomography scan, providers can use FNA to collect tissue from deeper areas of your body. Okay, so using imaging guidance, we can collect the tissue from the deeper areas like pancreas, gastrointestinal tract, esophagus, trachea, lungs, mediastinum. Mediastinum is nothing but the space in your chest that holds important organs like your heart. Okay. therapeutic fine needle aspiration. So we had seen what is the diagnostic purpose of FNA. Now it's therapeutic. Providers sometimes use FNA to remove fluid from masses to help treat them, like abscesses. So in the abscess there will be a fluid inside the wound, right? So to remove that we can use FNA, that is buildup of pus. Cyst, fluid filled sacs, seromas, abnormal buildups of fluid that are common after breast cancer surgery and plastic surgery. To remove that fluid, we will use this FNA. As this is a thin needle, they may use this technique instead of standard incision and drainage approach in cosmetically sensitive areas. So instead of incision and drainage topic, we will go. So this is the FNA is the first topic. We will go on by one: incision, what is debridement, everything. Okay, so instead of incision and drainage, they will use fine needle aspiration in the cosmetic sensitive areas like a breast. However, FNAs can potentially spread infections, so providers can't use them in all cases. So we can't use them in all cases. There should be some like limit and specifications to where to use and where not to use FNA. Okay. Fine needle aspiration is a diagnostic percutaneous procedure that uses a fine gauge needle, often 22 or 25, and a syringe to sample fluid from a cyst or remove clusters of cells from a solid mass. So the skin is cleansed. If a lump can be felt, the physician guides a needle into the area by palpating the lump. If the lump is non-palpable, the FNA procedure is performed using ultrasound fluoroscopy, computed tomography, or MR imaging with the patient positioned according to the area of concern. So if it is non-palpable, they will perform this under an imaging guidance. Okay. So final aspiration codes received new instructional notes on the definition of final aspiration, and a coronal biopsy were updated. So imaging guidance was added to the 9 new codes, and reporting imaging guidance separately is no longer allowed. So imaging guidance in the radiology, there will be some codes in radiology. So while you coding this final aspiration, you should not append that imaging guidance code with this, because they had updated every code with imaging guidance in fine needle aspiration codes. Okay. So guidelines also direct that the codes are selected based on type of guidance included, and there are add-on codes for each additional lesion for same imaging modality. If using different imaging modalities, for example, like what they're telling is the code should be selected based on the guidance, imaging guidance like fluoroscopic, ultrasound, what guidance used. We need to choose the code according to the guidance. Okay. And there are add-on codes for each additional lesion for same modality. So if there is a same imaging modality, so both the breast FNA and the abdomen FNA both had done using the ultrasound guidance, you need to like add the additional code for the same imaging modality, as that both was performed by same imaging guidance. If using different imaging modalities when more than one lesion is involved. Okay. So one is like one, the breast biopsy was that the FNA was done by ultrasound, and another the abdomen biopsy was done by fluoroscopic guidance means. So what you should do, when more than one lesion is involved, obviously two lesion is involved in my example, modifier 59 is appended, you should add modifier 59. Okay. So by adding the modifier 59 in the code, they can easily understand that these two FNA were performed on different modalities using different imaging guidance. Okay, CPT code 10021 FNA without imaging guidance remains. So CPT code 10022 was deleted and replaced with CPT 10004 for each additional lesion. CPT codes 10005 to 10012 were added to report the specific imaging guidance, ultrasound, fluoroscopy guidance, CT, MRI. So don't get confused. So just you need to know, you need to code based on the imaging guidance. So you should not add imaging guidance code separately with the fine needle aspiration codes. Okay, the imaging guidance codes are from radiology chapter. You should not add it unless otherwise in the parenthetical guidelines. If they give, check the radiology guidance code, you need to add. Otherwise, until that, you should not add the guidance code from the radiology chapter. So because the guidance code is already included in this final aspiration codes, you need to choose according to the guidance used in the final aspiration procedure. So the next guideline is when, when they are using different modalities, that different imaging guidance for different lesion, you need to append modifier 59 with the code. Okay, so this is the basic guideline you need to understand. When you keep on saying like loud, you can easily able to understand it. So like read it loud. So these are the codes, like 10021 is fine needle aspiration biopsy without imaging guidance, the first lesion. Plus, this plus indicates that is an add-on code. You should not place the add-on code at first. Okay, so you need to give the primary code. After that only you can give this add-on code. So final aspiration biopsy without imaging guidance, each additional lesion. For example, if the patient is having two lesions, they are using with same imaging, like yeah, without imaging guidance, using without any imaging guidance, they are doing final aspiration in two lesions. For the first lesion, you need to code 10021, comma 10004. Indicates using the code they can understand. Okay, final aspiration biopsy without imaging guidance is done. So that is the code 10021. And for the additional lesion, so there should be two lesion. By seeing the code 10004, they can understand another lesion was biopsy. Okay, so what is 10005 final aspiration biopsy including ultrasound guidance first lesion, plus 10006 final aspiration biopsy including ultrasound guidance each additional lesion. So 10007 is fine needle aspiration biopsy including fluoroscopic guidance first lesion, plus 10008 is fine needle aspiration biopsy including fluoroscopic guidance. 10009 is fine needle aspiration biopsy including CT guidance first lesion, plus 10010 is final aspiration biopsy including CT guidance each additional lesion. 10011 is final aspiration biopsy including MR guidance first lesion, plus 10012 is final aspiration biopsy including MR guidance each additional lesion. So they had included everything, the every imaging guidance, right? So final aspiration, so including ultrasound guidance, so no need to add any code from radiology. So including ultrasound guidance, here fluoroscopy guidance, here CT guidance, here MR guidance. For each guidance, for each modality, they had included the code to this FNA code. Okay, so imaging guidance codes can no longer be assigned along with FNA procedure, as I had already told you that. When more than one FNA biopsy is performed at separate lesions, same session, same day, same imaging modality, use the appropriate imaging modality add-on code for the second and subsequent lesions. Yeah, as I told you, if both the lesions, there are two lesions, one in the breast and one in abdomen, both they had done the final aspiration in both the lesion on the same day. Okay, using the same imaging guidance means you can use the primary code and add-on code of the same imaging guidance. For example, it is done through ultrasound guidance means the primary code is for ultrasound and the additional code is for ultrasound, because they had used the same guidance for the final aspiration procedure in both the lesion, right? So when more than one FNA biopsy is performed on separate lesions, same session, same day, using different imaging modalities. If they are using different imaging guidance means we need to report the corresponding primary code with modifier 59 for each additional imaging modality and the corresponding add-on codes for subsequent lesion sample. For example, the lesion like FNA procedure in the lesion in the breast had done through ultrasound guidance, and the FNA procedure in the lesion in the abdomen, if it is done through fluoroscopic guidance, you need to open modifier 59 with the primary code. You should not add with the add-on code. You need to add with the primary code indicating that the two lesions FNA procedure were done using different imaging guidance. You should not miss 59 modifier. So this instruction applies regardless of whether the lesions are ipsilateral or contralateral to each other, whether they are in same or different organ structures. So it is regardless. Okay, so you need to see only whether different imaging guidance is used. So you don't need to consider whether it's ipsilateral or contralateral, so like opposite to each other, same organ system or different organ system. You don't need to care about it. You just need to see whether they are using same imaging modality or different imaging modality. This is the most important point. Okay, when FNA biopsy and corneal biopsy both are performed on the same lesion, same session, same day using the same type of imaging guidance, do not separately report imaging guidance for the core needle biopsy. Now here's the twist. For one, they are using both FNA biopsy and core needle biopsy on the same lesion. If in the breast lesion they are using both FNA and corneal biopsy using the same imaging guidance, you should not separately report the imaging like guidance for the core needle biopsy. When FNA biopsy is performed on one lesion and core needle biopsy is performed on separate lesion, same session, same day using the same type of imaging guidance, both the core needle biopsy and imaging guidance for core needle biopsy may be reported separately with modifier 59. I hope you understand. In the same lesion, if they are doing both FNA and corneal biopsy, you should not separately quote imaging guidance for corneal biopsy. But if they are doing FNA in one lesion, corneal biopsy in another lesion, you should quote both and append modifier 59. This is the thing. This is the guideline. Okay. So when FNA biopsy is performed on one lesion and corneal biopsy is performed on separate lesion, same session, same day using different types of imaging guidance. Now you need to see here it is using different type of imaging guidance. Both the corneal biopsy and imaging guidance for the corneal biopsy may be reported with modifier 59. Okay. So types of biopsy, description, goal, codes. So in FNA, the description is very thin, the hollow needle attached to the syringe. So what will it do? Take out small amount of fluid or cells or very piece of tissue. Okay. So core needle, it's a hollow core needle. Remove small samples of tissue in cylindrical shape. Okay, so in fine needle there is specific tissue not identified, that you can't identify the specific tissue. So core needle is used to code to body area, so you need to code to body area. Excisional biopsy, percutaneous excision, also called wide local incision biopsy. So it will remove entire tumor with margins. You need to go to body area. Incisional biopsy, it is also a percutaneous incision. Remove small part of large tumor. Go to body area. So note, FNA biopsy codes are selected according to the modality, that is type of guidance used. Other biopsies are selected according to the body area. This is an important note. So while coding for FNA biopsy, you don't need to worry about where like the organ system, nothing. Okay, you need to see only the imaging guidance, that is the type of modality used. For other biopsies, you need to concentrate on the body area. So modify 59. So we had seen modify 59 somewhere in the guideline, right? So you need to know why we are using this modify 59. The guidelines for FNA include use of modify 59, which is distinct procedural service. So modify 59 is used to indicate that the procedures are not bundled in a specific case. Okay, so you should indicate that the procedures are not bundled in specific case. Bundling. What's bundling? The incision of smaller services into larger one. Only the larger service is coded. The services are part of global surgical package. Sometimes more than one service is performed during a surgical session but are not bundled. This is because the procedures are performed on different sites or organ system, performed during different surgical sessions, require separate incision or excisions, separate injuries. So sometimes, so some procedures are not a part of global surgical package. Why? The reason is maybe that performed on different sites or organ system, maybe they perform during different surgical sessions, maybe they require separate incision or excision, maybe they have separate injuries. In FNA codes, Modify 59 indicates that surgery included different lesions or different modalities. That's why we are using Modifier 59. Before finding FNA codes, you should check, was guidance used for FNA? Any guidance? Ultrasound, fluoroscopic, MR, CT, any guidance used? So you need to check any guidance used for FNA. Was more than one lesion biopsied using FNA? So you need to check any, like more than one lesion, like one lesion or more than one lesion or biopsied using FNA. If more than one lesion biopsy, was the same type of guidance used for each? So the next thing you need to check, if more than one lesion biopsy, was the same type of guidance used for the different lesions. You need to check that. Next, were FNA and coronal biopsy performed on same session, same or different lesion? Then you need to check the FNA and coronal biopsy are performed on the same session or same or different lesions. So you need to check these conditions before coding for FNA. First thing, guidance used. So 10021 is without imaging guidance, 10005 is with ultrasound guidance, with 0007 is with fluoroscopic guidance, 10009 is with CT guidance, 10011 is with MR guidance. These are referred to as primary codes. Each have an add-on code. These are referred to in guidelines as modalities, that is imaging guidance. Was more than one lesion treated? List separate add-on codes for each additional lesion. The codes are +10004 with no imaging guidance, +10006 with ultrasound guidance, +10008 with fluoroscopic guidance, +10010 with CT guidance, +10012 with MR guidance. So if there is an additional lesion, you should use this add-on code with the primary code. Was the same type of guidance used for each lesion? If the answer is yes, for example, the lesion, the FNA procedure in the lesion in the breast and in the abdomen both had done using the ultrasound guidance. If the answer is yes, the same imaging guidance is used. So for example, FNA of 3 lesions with ultrasound guidance means the primary code is 10005 for lesion 1. For each additional code you need to code that imaging guidance code, right? So for ultrasound guidance the additional code is add-on code is 10006. So they had mentioned 3 lesions, so 10005 is for one lesion. For each additional lesion 10006, there are 3 lesions, so you need to add again 10006. Okay, so there will be 3 lesions using the same imaging guidance. So now we will practice some questions so that you can easily understand how to implement the guidelines in your code. So the question 1 is fine needle aspiration biopsy of one lesion in the right lung and one lesion in abdominal wall during the same surgical session. Both biopsies used MR guidance. So before coding FNA, you should consider the 4 points. You should ask the questions before coding for FNA. Was guidance used for FNA? Yes, here in the question they had mentioned MR guidance is used. So it is yes. More than one lesion biopsy using FNA? Yes, in the question they had mentioned two lesions, one in the right lung and one in the abdominal wall. Yes, lung and abdominal wall. If more than one lesion is biopsied, was the same type of guidance used for each. So yes, they had used MR guidance for both the biopsies. Where FNA and core needle biopsy performed on same session, same or different lesion. Here, core needle biopsy is not used anywhere, so the answer is no. So, fine needle aspiration biopsy of lesion in right lung, the code is 10011, and the FNA biopsy of lesion in the abdominal wall, the code is plus 10012. So the FNA of abdominal wall. So use primary code and its add-on code since both FNA use same modality. Note that it doesn't matter that the lesions were in the different body areas. So you need to see the imaging guidance, that is the modality alone, while coding for FNA. As these two belong to different body areas, you don't need to worry about it. So while coding for FNA, you should watch only the modality, the imaging guidance. As these had performed on same imaging guidance, you need to code the primary code and add-on code for the same imaging guidance performed. Okay. So was the same type of guidance used for each lesions. Before in the last example we had seen that imaging guidance used was same, but what if it is no? If they use different imaging guidance for different lesion, means what we should do? So list two codes: primary code for modality 1 and primary code for modality 2 with modifier 59. Doesn't matter if lesions are ipsilateral, that is same side, contralateral, opposite side from each other, and whether they are in same or different organ structures. Do not separately report guidance code from 77000 section of CPT. Each FNA primary procedure and add-on code include type of guidance. So we don't need to report the imaging guidance code from the radiology chapter separately. Okay, so if the imaging guidance is same, you need to like code the primary code and add-on code using the same imaging guidance, as there are specific codes for that. If the imaging guidance is different, so use one primary code for like support. I will give some example. The next slide is an example practice question, so through that you can understand. So final aspiration biopsy of lesion in the right lung using MR guidance, and FNA biopsy of lesion in the abdominal was using CT guidance. So now two lesions they are performing FNA, and one is using MR guidance and another one is using CT guidance. So was guidance used for FNA test? Yes. More than one lesion biopsy is your FNA? Yes. If more than one lesion biopsy was the same type of guidance used? No. For lung it is MR and abdominal wall it is CT. Where FNA and core needle biopsy performed on the same session, there is no topic such core needle biopsy here, so the answer is no. So the FNA of right lung, okay, right lung the code is 10011. FNA of abdominal wall 10009. As these are using different imaging guidance, you need to append modifier 59 with modality code. Okay, that's why they had added 59 modifier to 10009. Each FNA used a different modality. Report separate primary procedures with modifier 59. You should not add modifier 59 with add-on code. This is a primary code. As FNA of abdominal wall, the primary code is 10009. We had added modifier with that primary code. Note that it doesn't matter that the lesions were in different body areas. Again, we need to see the imaging guidance. You don't need to worry about the body parts. Sometimes there are three or more lesions and two of them use same modality. If such condition exists if there is 3 lesion and 2 is using this MR guidance and 1 is using ultrasound guidance, means you need to code primary code for modality 1 and another lesion will be like they had performed using the same imaging guidance, right? For that you need to use the add-on code for the different imaging guidance biopsy, like perform this different lesion. For the different imaging guidance you need to code another primary code, right? You understand? So practice question 3. So fine needle aspiration biopsy of 2 lesions in the right lung using MR guidance, one lesion in the abdominal wall using CT guidance. No, that is the example for the previous one. So was the guidance used for FNA? Yes, we had used the guidance. More than one lesion biopsied using FNA? Yes, 2 in lung and 1 in abdominal wall. If more than one lesion biopsied, was the same type of guidance used? No. Lung, MR and abdominal wall CT. Where FNA and core needle biopsy perform same session, there is no such topic for core needle biopsy, so not applicable. So 10011 for the first FNA of right lung. There was another biopsy, right? So we need to give add-on code 10012 for second FNA of right lung, and there is another like FNA procedure in the different lesion using different imaging guidance. So for that we need to code the primary code for that imaging guidance, that is for CT. 10009 is for FNA of abdominal wall, but using modifier 59 as we are coding for different imaging modality. For the 2 FNA in lung, same modality, use primary code with its add-on code. Don't add any modifier for the same imaging modality. Use for FNA in abdominal wall, different modality than biopsies of lung. Use primary code with modifier 59. Understand? Where FNA and coronal biopsies performed on same session. So if it performed on same session, coding depends on whether both biopsy types were on the same lesion or different lesion. Coding also depends on modality used. So if the FNA and coronal biopsies performed on the same session, you need to know whether they both the procedures are done on the same lesion or different lesion. Another thing we need to see is the modality used. Okay, so FNA and coronal biopsy during the same session, same lesion, same type of imaging guidance, means use primary code for FNA with type of guidance. You use code for core needle biopsy. So you need to code the primary code for the type of guidance used, and you use code for coronal biopsy. Do not code separately for guidance for core needle biopsy. Okay, so if FNA and coronal biopsy is performed on the same session, same lesion, same type of imaging guidance, means you need to put the primary code of FNA with type of guidance. For the coronal biopsy, you need to code the coronal biopsy alone without adding any imaging guidance data in it, right? So do not code separately for guidance, as they both FNA and the coronal biopsy using the same imaging guidance. You should not code separately for guidance for core needle biopsy. It's important. It's practice question. So final aspiration biopsy of lesion in right lung and coronal biopsy of same lesion, same session, both using CT guidance. Was the guidance used for FNA? Yes. More than one lesion biopsy using FNA? No. One is done using FNA and one using coronal biopsy. The answer is no. If more than one lesion biopsy using FNA, was the same type of guidance used? As only one lesion is biopsed using FNA, so in the here the answer for this question is not applicable. Was FN in coronal biopsy performed on the same session? Yes. Same modality, same lesion. So FNA of lesion using CT, that is 10009. Core needle biopsy of lesion using CT is 32408. So not under code states guidance is included. That means you should not code any imaging guidance code along with it, because this code in this code the guidance is already included. So you need to code 10009 with 32408. So if it's like different lesions, now we had seen both FNA and corneal biopsy in the same lesion. What if it is done on different lesions using same imaging guidance? Okay, use primary code for FNA with type of guidance. Use code for each corneal biopsy with modifier 59. Use code for guidance for corneal biopsy with modifier 59. Understand it? Use primary code for FNA with type of guidance. Okay, use code for each core needle biopsy. So whatever the code, like each core needle biopsy code with modifier 59. Use code for guidance for core needle biopsy with modifier 59. Now we have to code for the guidance of core needle biopsy with it too, right? So if it is in the same lesion, you don't need to code for the guidance used in core needle biopsy, but if it is a different lesion, you need to code for the guidance for the core needle biopsy with modifier 59. So final aspiration biopsy of lesion in the right lung without guidance. So see, biopsy of lesion right lung without any guidance, and coronal biopsy of mass in abdomen using CT guidance. So was guidance used for FNA? No, in the FNA there is no guidance is used. More than one lesion is biopsied using FNA? No, only one lesion. If more than one lesion is no, not more than one lesion is here, so it is not applicable. Was FNA and coronal biopsy on the same same lesion or same session? No, it's different. So FNA of right lung is 10021 without any guidance. Core needle biopsy of abdomen is 49180 modify 59, and we need to code for the guidance also, right? So note, we need to check whether if you have see like 7 chapter code, you need to see if any parenthetical guideline below your code there will be some parenthetical guidelines. Like for example, if you are seeing one code, okay, for this core core biopsy code, below that code they will be given one parenthetical guideline. So inside the parenthesis they will give like, if imaging guidance is performed, see 771012, which means you must see that code, you need to add that code. If the parenthetical guidelines is telling you to code somewhere, go somewhere, see somewhere, you need to code that code. So usually we should not append any imaging guidance code with that, but if the parenthetical guidelines allow you to code, you need to code. Okay, so the coronal biopsy of abdomen is 49180. We need to append modifier 59, as both FN and coronal biopsy are done on different lesions. We need to add imaging guidance code for the coronal biopsy, as in the parenthetical guidelines it had mentioned to see 77012. We need to use that imaging guidance code with modifier 59. So what is a guideline summary? So what and all we had seen. So FNA, if it is done on different lesions, same modality, so we need to code the primary code and its add-on code. So if the FNA done on different lesions, different modalities, we need to code primary code for each FNA with modifier 59 on the second code. You should not add modifier 59 with the primary code. So if the FNA and core biopsy is done on same lesion, same modality, you need to report both codes. So you do not report imaging for core biopsy. If the FNA and core biopsy is done on different lesions, same modality, report both with modifier 59 on both core biopsy code and code for guidance of core biopsy code. So if FNA and core biopsy perform different lesions, different modality, report both, use modifier 59 on the core biopsy and imaging for core biopsy. So hope you have understand the fine needle aspiration. So you need to revise it, practice more questions. This is a most important topic. So if you understand the procedure, what is fine needle aspiration, and if you compare with another biopsies, it will be easy to understand, right? So what is core needle biopsy, or like what is the difference between core needle and FNA? So fine needle aspiration, everything. So go through it. If you have any doubt, do comment. Thank you.